Good morning, everyone, and thank you for joining us for our board meeting this morning. I would like to call this meeting to order. The time is 8:04, and I'll begin with calling roll call. I just wanted to have the agenda up here just briefly so you all kind of know what the items are in the order they are. I won't put it up constantly, but just a quick peek. So I'm gonna stop sharing right now just so that I can access the roll call roster. Okay. Where is it? Okay. So I'll now call roll to establish attendance. If you hear your name, please say present or here or whatever works for you. April Meckins Jolly,
Present.
Nebu Kolanachi,
Colin Jerry and
Colin
present.
Cherry, thank you.
You got it.
Deidre Griffith, Colleen McNicholas, Dr. Melissa Tapey,
Present.
Dr. Imbal Shakum,
Here.
Elizabeth Ebert, Dr. Barbara Luty, Dr. Morgan Shields,
Here.
Brittany Jones,
Present.
and Dr. Christopher Daly.
Present.
Okay, thank you all. And as I said before, we do have quorum, and so I'm going to move to the next agenda item on the meeting to approve the meeting minutes for the December 18th, 2025 meeting, the in-person meeting at the department office. Is there a motion to approve the December 18th, 2025 meeting minutes?
So
So moved.
moved.
All
Well,
right,
I
is
can
there a
second.
second? All right. It has been moved and seconded to approve the December 18th, 2025 meeting minutes. Is there any discussion? Okay. All those in favor say aye.
Aye.
Aye. Aye.
Aye.
All those opposed say no. Okay. The motion carries and the December 18th, 2025 meeting minutes are approved for the record. And with that being said, I'm going to turn it over to our Vice Chair, Brittany Jones, to facilitate the board committee updates.
Thank you, Kristen. In regards to updates, we had a meeting a couple of days ago on Tuesday. We had our first quarterly joint committee meeting where all of the committees had a chance to come together, share some updates, but also have a chance to think about what our public health priorities are, what our goals are. So we've came up with a list and we'll be working at the next meeting on the 14th of April to decipher which goals will be our priorities. At this time, we did not have any committee updates in that meeting, and so that is our update for today. And I'll pass it back to you, Kristen.
Thank you, Brittany. We'll also take this time to hear from the other committees to share out our community engagement committee, our governance committee, and then our academic partnerships committee. So I will start from community engagement committee. We typically meet every month. Given the holiday, we did not meet because the first Thursday of the month fell on New Year's Day. So we'll be picking back up our meetings next month. We usually have the wonderful Shantae join us to kind of just be a liaison and connect us to the deep work that's happening at the department so that we're really having some insights and then being able to offer the best support. So we look forward to reconnecting in that regard. Um, the most we've just really discussed is their outreach efforts. They've been doing epi minutes and all sorts of cool information sharing from the department. And Shantae, I guess I can offer you the floor for a moment if there's been any newer updates that we haven't had a chance to discuss, if you don't mind.
Sure. I think the biggest thing that I would like to share at this time is about our push for the related to the influenza surge. Because we did know that it was elevated. We actually did several things. We currently still have an ongoing heavy push on social media about how to stay safe, signs and symptoms, the importance of vaccination. We issued a HAN Alert, Health Alert Network message just to our partners to let them know that we are aware there is a concern and things that we are imparting to the community. We shared a letter related to the surge to schools across the city through our health nurses in CD. We've also elevated our videos, especially the ones that are influenza related and, respiratory illness and staying home when you're sick. Um, uh, on the website, on the main website. I'm sorry. And then we did an additional updated, like current advisement for it's a PSA basically that we're sharing as well with Dr. Alex Plurad on one of our on our social media and however we can share it. And that's another idea. If you'd like, we can share these snippets, these episodes with you so that you can also share them through your networks. And then finally, we know that we still have a little ways before we hit our peak for this season. And so we are going to be reutilizing or repurposing our billboards that are out in the community, stressing a call to action for people to, encouraging people to vaccinate or to, and then just the main line about staying home if you're sick, wearing a mask if, you have to go in, washing your hands, that type of thing. And then we also have radio spots in English and in Spanish that are also circulating. Just to highlight the importance of just being aware during this influenza respiratory illness season. And then also just recently our commissioner was on STLPR and it escapes me the subject matter. If you could share with the doctor or Commissioner Anwuri the topic, for some reason it escapes me.
It was on the flu.
Of course, it was the flu. It was so we've been out in the community trying to be as present as possible and sharing as much information and as many mediums as possible to improve safety and awareness during this respiratory illness season. And that's it.
Thank you so much, Shantae, for sharing that. Very exciting things to hear. I will go ahead and see if there's a representative. Yeah, the chair of the Academic Partnerships Committee.
Hi, everybody. We met in December focusing on internships and finding ways to work and collaborate on internship development where we can promote the idea of teams on site at different internships. So Amy Eslin from Lindenwood University is really working to collate all the ideas of who and how people are different universities are required to do different pieces of the internship. So they're doing that. The other piece I've pushed out in my group for St. Louis University, any requests for guest speakers. So I'm going to follow up with the commissioner this week, let's say, that's tomorrow apparently, and by tomorrow to see if we can, where we are on guest speakers, or if we can reach out individually to guest speakers. I know I am currently teaching a class, would love a guest speaker. But other than that, we are still working on trying to figure out the best pathway for supporting the work and at the health department, and how do we collate and communicate the latest research and making sure we're getting it back to the health department. Thank you.
Awesome. Thank you so much. Now we'll move on to governance, and we'll have the chair speak on that behalf.
Thank you. We talked a little bit about this on Tuesday, but we, as a body, still need to do our Sunshine Law training. And so I will get back with the city councilor's office so that we can hopefully do that as a group. But if there's a need and an option for folks to do that on some other schedule that might work for them, I will make sure that we as governance work with the city councilor's office to make sure that everyone gets what they need. And as a reminder, the Sunshine Law training is a legal requirement that we all need to take part in, based on an ordinance that was passed last year. We approved our bylaws in December. Yay! Which was a heavy lift. And so we don't need to review those again until 2027, or if there is a need prior, then of course we shall. But the other items that governance is responsible for, of course, is to help fill openings on the board, and to come up with a better, more effective system to orient and train members of the board. And so I would just invite every member of the Board of Health to please forward us your thoughts, especially those of you who are newer, on what elements or knowledge or tools would make joining this board a smoother process, and anything that you feel board members in general need to know, because we will be speaking about those things at some upcoming governance committee meetings. Thank you.
Awesome. Thank you so much, April. I am going to bounce it quickly back to Brittany Jones just to talk a little bit about advocacy. I know she already discussed the joint committee meeting that we had, and then just any advocacy updates that you have, Brittany.
No advocacy updates at this time. We were able to make a number of we had a number of opportunities last year in being able to advocate on behalf of the St. Louis City Health Department, in which we continue to be able to explore in collaboration with the commissioner on ways the board can be more effective in the way that we advocate. And we are looking forward to that. And that conversation is a part of today's agenda, as well as ongoing conversation within the quarterly joint committee meetings. And I think that we'll get to the public health advocacy in a little bit later.
Thank you so much, Brittany. If there are no questions about any of the committee updates, we all look happy. Great. I'm going to go ahead and move to Commissioner Anwari to give some health department updates. I'll just kind of name some of the topics that we'll cover so that the commissioner can kind of simultaneously just go through the updates. So we'll start with the impact report overview from their year of 2025 and the impact they made on the city, and then move into discussing respiratory viral illness surveillance that's occurring right now in the city and perhaps across the region. And we'll end with having some discussion around public health advocacy. Commissioner Anwari?
All right, can you all, oh wait, I have to share my screen. Can you all see my screen?
Yes.
Okay, great. So you all know, Happy New Year, everybody. This is our first meeting of the new year. So just Happy New Year and welcome to our newest board chairs, leadership in Kristen and Brittany. And I want to thank April Jolly publicly for her commitment to our board for the past few years. And so I'm happy to have new leadership shape up and work with y'all going forward. So as you know, every year we put out an impact report. This year, we're going to put it out this month for 2025. I wanted to just highlight a few things from the impact report, which you will be getting or receiving later this month. And so that's what this presentation will focus on. So the City of St. Louis resident population is a little bit more than 280,000. And we receive about 2.5% of the city's general revenue for in use tax dollars. And we also have, we're about 51 to 49% use tax dollars to grant funding, which brings our total budget to 3.5 million. 35.5 million. And you can see the breakdown of our budget. The largest bucket is with the Healthcare Trust, which was established years ago as an effort to help boost enrollment in Medicaid expansion, and now continues to be a lot of our work focusing on community and public health efforts in the community. The second largest bucket is the Director's office, which includes many of our support staff, including all of our fiscals team and our communications team, and our epidemiologists. Then followed by that is our Environmental Health Bureau, which is one of our largest bureaus, which includes several different programs, followed by Animal Care and Control. And then you can see the last two are communicable disease, family, community, school health, and then the commissioner's budget. So one of the main goals in public health is to really get health information, accessible health information out into the community in equitable and evidence-based ways. And we've done that this year. We've reached over 13,000 individuals. More than half of that was spent participating in community events. And the rest is through focus groups or trainings and education. This year, we obviously were focused a lot in the tornado impacted area. And so the main zip code was 63103. And then we've also, as Shante mentioned, we've boosted our flu campaigns this year, focusing on a lot of very exciting media content, but also making sure that we, again, translate messaging into at least 10 different languages this year, which is new for the department. I'm really excited to launch those campaigns. Like I mentioned before, and you all have seen this, we've also launched something called an Epi Minute, which allows us to connect with the people of St. Louis City by breaking down data for residents and also providing health education. Most of our Epi Minutes in the beginning of this campaign were focused on respiratory season, so including flu, COVID, and RSV. But we've also done some exciting Epi Minutes around the holidays related to food safety. We've done some around lots of different topics, and they've been exciting to see. And so our EPIs are the ones who are mostly on camera doing these, and they are partnered with our program subject matter experts. We've also increased outreach with our outreach van. I believe it's about double what we have done in prior years. And it's used a lot by our HIV prevention team as they go out and provide information to residents around STDs and STIs and HIV. we have several community, or as part of our St. Louis Regional Partnership for a Healthy Community, we have our Community Health Improvement Plan initiatives, which include several action teams. We held an event probably last month where we brought all of our partners together. I believe that's about 52 partners who are actively working with our action teams to get messages out into the community, and also do community focus groups. We have done something different this year, or new this year, with additional funding from the state, where we've worked with a fiscal agent to provide mini grants to the action teams to help bolster their work and promote impact. We you can see at the bottom, maternal child health specifically has done a lot of outreach with safe sleep kits, but we've also done a number of things around behavioral health and chronic disease. And we've excitedly developed worked with the chronic disease action team to develop a St. Louis collaborative on nutrition and health to develop their 10-year strategic plan. Communicable disease has done a lot this year. If you look at the numbers between 2024 and 2025, we increased our condom distribution at our condom distribution sites. We've also increased the level of free services provided. Additionally, we have managed a high number of latent TB cases, 90 latent TB cases. Treatment kills dormant TB and removes the risk of latent infection becoming active. And so this is really important to be managing those latent TB cases. So excited to work with our partners at Affinia Healthcare in our TB clinic, and then also with this WashU TB physicians. Family Community School Health has also, as you can see, greatly increased their reach from 2024 to 2025, including a lot more resident-facing education. We've connected with women of childbearing age, 124 women, and we've continued postpartum toolkits distribution and postpartum education with community. In total, they completed 10 outreach events in underserved communities and have served 598 residents. That's more than 10 times the goal for this year. So really excited about that. And then our behavioral health program continues to distribute Narcan, with over 6,000 Narcan doses distributed. We also have had about 1,200 walk-ins to our Behavioral Health Bureau site here at the Department of Health. We've also worked with, we're asked to be a part of a state crisis intervention program, which is working with providing additional social workers to be partnered with outreach teams across the city, from DOH, neighborhood stabilization, problem properties, and others, to just again be that provide additional services and resources to the community during crisis-driven situations. And then finally, as I mentioned, our largest bureau, the Environmental Health Bureau, has welcomed 2 new supervisors, which we are really excited about. We have a established supervisor with the food and beverage program who brings more than 28 years of his experience to that role. So we're really excited about that. And then we also have a new animal care and control supervisor who has started this about 2 weeks ago. And she's really hitting the ground running and taking a lot of initiative in the field. We have upped, as you can see, we've the number of total of food inspections has gone up dramatically since 2024. And then we've also, you can see at the bottom some of our community sanitation numbers, which includes complaints around pest issues, structural problems in buildings, refuse, hazardous material, air pollution, and vector control. So that team is continuing to be busy. And these numbers have definitely increased after the tornado. And we're continuing to work on that effort. And now I will take questions.
April?
Thank you. Thank you so much. As always, this is a little bit of maybe preaching to the choir, but the work that you and your team lead, especially given the current climate, is just, it's wonderful to see and feel, because I am someone who also lives in the city, and I have seen and been a part of some of the work that your team has been driving. So thank you. I have a question about how we as board members can use some of this data to help support your work. So, for instance, are there areas where you are seeking some additional partnership where board members can be helpful in helping find partners, or even, the right kind of partners for some of the projects that your team wants to drive?
Yeah, I think aligning with our action teams is really the best way to kind of plug in. Again, like I mentioned, there's about 52 partner organizations that we work with, and we always are looking for new input from new partners. And so I think the best way really is to plug in with the action teams. We do have an action team coordinator in our health marketing administrator position, or the GSA, the government services analyst position here at the department, that works diligently on the CHIP and the action teams every day. So I think it's probably maybe one time we can maybe invite those staff to one of our board meetings to really talk through the focus areas of the action team and how the board can plug in directly.
Thank you.
I echo April's sentiments. Just congratulations on growth, hiring new supervisors, having increasing numbers of impact. All of that is always exciting to see. I know the city has been so busy, and every time I look up, I'm just like, man, the city just has so many different priorities that they're managing. It seems like the tornado happened. First it was sinkholes, then tornadoes, and lots of flu, which we'll talk about, and the animal and can control issue now with monkeys and goats in the city. So it's just a lot. If y'all have anything to say about that, I'd love to hear any updates. But just praying with you all. I know it could be, difficult, but you all remain diligent, and your commitment to city residents and public health is very much seen. My question, I had one. When Commissioner Nwari was talking about the action teams, I think that's incredible. And I know we kind of briefly talked about that Tuesday. Correct me if I'm wrong, Commissioner Nwari, you are talking about the action teams that are associated with the Regional CHIP Initiative, correct? Okay. And
Yeah.
so I serve on the maternal child health one, and they did just send out a newsletter, which included a link that I'm happy to share with board members, because they're in a season of wanting to recruit more people to join those action teams. And so you can choose which one speaks, to your passion, to your expertise. I'm happy to share that to board members who have capacity to see if they can lend in voices. I have found those spaces to be great for networking, also great to bring other people in. I know I've sent the link to a few people that were looking for some spaces to, lend their expertise and continue their work in whatever respective sector that they, mostly are present in. So I'm happy to do that. And this is kind of part of our regional effort. And so a lot of the things we discussed in our meeting recently had a lot to do with that collaboration. So this could be an opportunity. The question that I had was, were there any department vacancies that we can help share to fill positions if you all had some, or if you knew how many? I know this is kind of on the spot, so if you don't know the number right now, that's fine. But department vacancies that we can maybe publicize so that those positions can get filled, or if there are any ones that feel like more priorities to fill. I know you said you had 2 supervisor roles that you filled, which is incredible. So if there's something else that we should know that we can help amplify, we'd love to do that.
Yeah, those two were the highest priority. We always, our numbers are becoming steady in terms of retention. But we do track that data on a quarterly basis with the number of vacancies. I can, if the board wants to, one of the positions that is increasingly challenging to fill are any of our nursing positions. And there's a lot of reasons for that. So any advocacy there or connection points that you all have with nurses, I know Dr. Tapey, you will probably echo the same sentiments. But we can, as part of our quarterly report, we do list the vacancies that we have, and we can amplify that every quarter if that's of interest to you all.
Okay. Absolutely. Thank you for letting us know. All right. Well, thank you so much for that impact report. Will we be able to have a copy sent to us of the report you just reviewed?
So this report is just the highlights. We will
Okay.
be developing a comprehensive impact report by the end of the month that we'll be sending to you all.
Sounds perfect. Thank you so much. The next agenda item will have David Courtney share some respiratory viral illness surveillance. Hi, David.
Hi, good morning, everybody. So thank you for having me back. Let me take a moment here to share my screen. All right, can you all see that?
Yes.
Great, thank you. All right, again, as introduced, my name is David Courtney, and I am an epidemiologist here with the City of St. Louis Department of Health. I work mainly with communicable disease. And today I'm going to speak to the respiratory season in 2025 to 2026. And I have worked closely with our senior epidemiologist, Matt Haslam, to collect all this data for you. So, as I'm sure you remember, last time I was here in November, I really did not have too much to say or speak on. Activity was low, but again, it was the beginning of the season. And now showing you the big picture, obviously, flu activity has skyrocketed. And again, typically when we think of respiratory season, we think of the big three. So also I'm going to speak today about COVID-19 and RSV. COVID-19 activity is currently low, but it is showing signs of increasing. And RSV is really kind of having a very moderate season, but it has also increased a little bit in the past month or so. So again, kind of speaking to the big picture item of influenza and influenza-like illness, what we have here first is the daily percentage of ED visits attributed to influenza-like illness. And obviously you can see through January 10th, the percentage has increased and become very high. If you look at the orange line right there, it's kind of poking up in the middle. Obviously that's a very, very high level. And for the past week, essentially that we have data for week 1, it was at 4.170%, which again is much higher than usual, and is kind of reaching that height that we reached last season with a very severe flu season. And this is kind of shows the reported case rates. Again, we're looking at the orange line kind of there in the middle. Obviously, you can see that it skyrocketed up at the end of last year, especially towards week 52. In the past 2 weeks, we've kind of seen a little recession in activity. And that could be because of, after the holidays, people aren't seeking medical care quite yet or lag in reporting. But with what is left of respiratory season, and there are several weeks, we could definitely see further peaks. So we're keeping a close eye on that. I will say that most of the influenza this season has been influenza A. And when those are sequenced, it's the H3N2 type. And furthermore, obviously, there's been a lot of headlines regarding subclade K, which is a type of H3N2, which is probably most likely driving the high activity just because the flu virus kind of mutated after the vaccines had been put together. So it's evading immunity a little bit. But as always, we do encourage vaccination. And kind of shifting gears toward RSV. RSV is not a reportable condition, but we do get to keep tabs on it through the state of Missouri and through laboratory testing through hospitals such as BJC. So again, right now it's very low and moderate, but it has shown signs of increasing. Test positivity right now for Missouri is about 4.2%. And then kind of getting like a micro shot through BJC, looking at that purple line right there. Again, RSV is kind of having a much quieter season than it has in the past. But it did obviously increase in the last couple weeks of the year and for 2025. And again, it has kind of dipped down a little bit in the past 2 weeks. But again, we're monitoring that, and there's still plenty of respiratory season left for it to increase. And again, the other big three numbers for COVID-19. On the left, we have kind of the full epi curve since 2020 and 2021. And you can obviously see the bigger spikes in the past. COVID-19 activity was increasing through the month of December recently. So we're keeping an eye on that. Obviously, we want to highlight, that sometimes there drastically reduced testing can impact numbers and surveillance, especially after the holidays. So that is kind of why we also look to wastewater and hospitalizations. And again, you can kind of see a larger picture here from 2023 to 2026 currently. Looking at the tail end of the graph on the left-hand side, you can see that in terms of wastewater, the numbers have increased through January 3rd. And then on the right-hand side, we have hospitalizations for Missouri for the big three. And you can see that flu has obviously increased exponentially in the past month. But also we see activity for COVID-19 and RSV. And just to keep you updated on the vaccination rates, obviously we can see that the older age groups are typically better at getting vaccinated. And we have some maps here too to show which areas of the city are more vaccinated than others. But really, I guess what we kind of wanted to highlight and discuss in terms of vaccination is we kind of compared these numbers to last year, and COVID vaccination numbers especially are down, and there's been the biggest decrease is among those that are children age. And flu vaccine numbers are fairly similar to last year. There is a slight decrease, but again, their largest decrease, unfortunately, was among pediatric age. And so here at the city, we're always encouraging prevention methods, and I especially want to thank our communications team for acting so quickly within the past couple of weeks and putting out some great material. But as always, we're highlighting to get your vaccination. Wear a mask if you must be out if you're feeling sick. Wash hands and, clean and sanitize frequently touched surfaces. Cover your coughs and sneezes. And if you are sick, please stay at home. And with that, I will go ahead and wrap up the presentation. And if you have any questions for me or any comments, please let me know. Thank you so much.
Thank you, Courtney. I think we do have a few questions. Inval?
Hi, David. It's good to see you. Thanks for presenting. This is great work. I have a quick question. If you could remind us, I think you did this on the last two, but if you could remind us a little clearer for flu and I guess all data, where are you getting reports of flu? Because I think that's important for us to remember.
Yeah, so for flu, we are receiving it from the major hospital systems and the local clinics as well. The major hospital systems are typically quicker with their data, of course, so we're always continuing receiving data. But yeah, essentially, we do get daily reports from the hospitals, and also to the state receives information or data, I should say, lab reports, and they forward it to us.
So anyone who's coming to care in the hospital system, sorry, not urgent care
Oh, we do.
clinics.
We receive urgent care as well.
Okay.
Yes. Yeah.
I just wanted to clarify, like people have to show up for care to know that we have flu in the system.
Right. Right.
Okay.
Yeah. Absolutely. Yeah. Testing.
Thank
Yeah.
you.
Through those systems is very important.
Thank you.
Yes, thank you. I think that's a good understanding in detail because I feel like everybody I knew was sick around the holiday. And so those numbers weren't as high as I was thinking they were. But that could be to the point that you all are making now that perhaps people aren't testing as much and just know they don't feel well, et cetera, et cetera. Um, okay. I am trying to think if I any other questions for anything that's been mentioned thus far. Okay. Then if we could move to the next agenda item, let me make sure I didn't miss anything in the chat. No, okay. We can go ahead and move to the next agenda item for the health department updates with Commissioner Wari talking about public health funding. And if you could add also, I know we kind of discussed maybe if there were some other strategic priorities that were outside of the Child Ship Initiative that maybe you had in mind to share with the board would be really helpful as well. So with that, I'll turn it over to Commissioner Wari.
Okay. This was the advocacy session, right? That was, okay.
Yes. Yes, sorry.
So I did want to raise, so the governor yesterday had the State of the State address, and I invite everyone to, it was recorded, so I invite everyone to kind of review that. At a high level, the budget for health, public health to the Department of Health and Senior Services is 52.3 billion. And the priorities that at least were mentioned during the speech and what has been put out there are I don't know if you all know, but there's Missouri-wide, there are the funding is for increasing outpatient competency restorative services for individuals to receive timely treatment in so to reduce the burden on local jails. So there's the money for that to increase timely treatment. There's an increase of funding for treatment of substance use disorders to the realm of 8.3 million. There's 62.1 million for Medicaid reform. And the largest bucket is for rural health transformation is 216.3 million, which is meant to support provider participation, delivery improvements, and care coordination activities to maintain and improve access to healthcare services in rural communities. And then I wanted to just share some opportunities. I think at the last meeting, you all were asking, well, how can the board best advocate for the department? And there's some opportunities if you aren't connected to the Missouri Center for Public Health Excellence. It's now called the Missouri Center for, or the Missouri Public Health Initiative. So it was MOCFI, now it's MOFI. If you're not connected to them, I would suggest you do get connected. They have regular Missouri legislature calls. And Kelly McGowan is the contact person there. They also have, they're doing, the next one is today actually at 3:30. There are also opportunities for education around Missouri. We do a course, not a course, but a session on Missouri Legislature 101. The next one is January 29th. And then there's something called they host Missouri MOCFI Day at the Capitol. And so that's an opportunity for any board members to potentially, if you're interested, join the departments. It's for all the departments of health in the state, but that is another opportunity for advocacy. That date is, don't have the date. Oh yeah, it's January, February, March 10th in person in Jeff City. Also wanted to share yeah, I think that's all I wanted to share there. So nothing specific that, I would just encourage the board to begin joining those Missouri legislature calls. And we can also bring, priority areas from those calls that potentially need championing by the board to this meeting. So I have.
Okay, thank you. I wanted to ask and or clarify when advocating for rural areas, when you mentioned the rural budget, I do know there's been expanded funding for healthcare in the rural areas. And so my understanding is that you all scope within the St. Louis region that you focus on as a department also extends out to a few counties like Franklin, Warren, maybe even St. Charles. Are those considered your rural counties, or how does the rural support, what is included in the rural support, what areas geographically, so that we know when we're advocating how that connects to the department in the city?
It doesn't. It's not, or we don't have rural counties. That effort is really being led by the Integrated Health Network with their program. So Brian Barker, who's now with the Integrated Health Network, has connections with lots of public health entities, including MOCFI, and is working with the Rural Health Transformation Project.
Okay. All right. Sounds good. And then did you have any other strategic priorities that you wanted to focus on as through the year and until any changes in administration happen that the board can help support? Or was that it, like just public health funding was the main one?
I'll be addressing some of that in the impact report. And so I'd be happy to, after we release it, to come back to the group to talk about future priorities.
Okay. Sounds awesome. Thank you.
This is Melissa. I'd like to ask a question if possible. Victoria, I saw that potential state funding for community health workers in various aspects, or the Women's and Minority Healthcare Initiative, may likely be decreased. The funding would be decreased in the state budget. Does that affect our public health department as well?
Do you know what specific grant that you're talking about? Not knowing,
Their proposals, it might be specific to FQHCs. I just wanted to make sure in this context, right, that it didn't affect the public health department as well.
yeah, no, we haven't, our community health workers are largely not federally funded.
Okay. Well, yeah, it's federal funding coming from the state budget for us. So I just wanted to make sure. Okay. Thank you.
And then I don't know if y'all heard yesterday, there are potential cuts to SAMHSA for mental health treatment. We do have one SAMHSA grant that we are the fiscal agent, but operationally it's led out of the Office of Violence Prevention. We are in year 5 of that grant, which is the last year. So we don't know specifically yet if we'll be impacted by the cuts, but that is a potential upcoming area for cuts.
Thank you for bringing that up. I remember seeing that list yesterday. And so when you mentioned, I think you mentioned there was a budget for substance use, and I didn't know, with the cuts, how that impacted the department. So you all are in your 5th year, you'll clear that at the end of this year of 2026. Is that correct?
Yes, it's in the 5th year.
Okay.
And we don't receive, from the state, we don't receive funding for substance use disorder. We do receive federal funds from the CDC through the state for substance use disorder, but we have no indication right now of if those funds will be cut. And that amount is like $160,000 every year. Our largest bucket for mental health funding comes from the opioid settlement dollars.
Okay. All right. We have something in the chat. Since the SAMHSA grants may be reinstated, there's confirmation of that, but haven't seen actually if those are really reinstated. Yeah, so maybe until there is a clear line, we could just have some brief updates around like if there's any developments you've heard or advocacy we can do on that part, if there is, as it gets closer to understanding where you'll be impacted or not, and how we can find other sources of resources to support the department. Okay. Are there any other questions about any of the reports before we move on?
Can you guys hear me? Speaker.
Yes, we can hear you.
I heard from our AJC behavioral health team that the cuts were actually reversed. I'm putting something in the chat. The SAMHSA. I think that's the article. I'll try to find exactly what they said.
Okay, thank you so much for sharing.
Okay.
Any other questions about health department updates? Okay. Well, if something comes up, feel free to email them if you think of it later. I did have 2 before we moved on to the next agenda item. The first one, I know in the last meeting we talked about the nationwide shortage on penicillin treatment for syphilis, and I don't know if anyone had any updates around what they've heard. I know that there's been some reports of manufacturing systems working on alternatives to be able to get information out there or be able to get treatment out there. And I didn't know if there were any formal updates that you have received at the department or if any other of the FQHCs have heard anything either.
I haven't.
This is Melissa. I don't have any kind of confirmed updates except to say that we, at least in our FQHC, have enough doses for now and are also hooked up with the city and county health department for supply. In case we did run out, the county health department does have a supply specifically for pregnant women that we can get an emergency, but we do have enough doses right now. But I'm not sure the shortage is over.
Okay.
I have confirmation of that.
Okay, good to know that you have what you need. Awesome. And I think the only last thing I was going to ask about, I couldn't remember if this came up in a meeting or actually why I had it in my notes, but I had like three-part viral testing. Like there's a swab that could test for all, like the triple test for viral. And I didn't know if the city had access to that or if there's been any discussion about how, folks can do the triple viral testing in this peak that we're seeing in respiratory viral illnesses.
We do not have any of the triple tests for the single COVID test. The problem with those tests is that if you buy a bunch of them, they expire. So we try to, during the peak of COVID, we did have a stash of them. But we do have a partnership with the Integrated Health Network through ARPA dollars, again, where we have free testing, vaccination, and treatment for COVID alone and or COVID plus RSV and flu is available to community members at no cost to them. I think I shared the flyer with you following the last meeting, but that's where we're pushing folks to go to get tested if they need it, and also vaccinated.
Perfect. Awesome. Thank you so much for sharing that. All right. That's all the questions I have. If there are no other questions, we can move to any announcements any board members or department staff may have. Any announcements? No? Okay. Well, I'm looking at my calendar to be sure that I'm right. Okay. I just want to be sure that you can just give me a head nod. Everybody got their recurring meetings on their calendars for the board meetings. Okay, perfect. So our next board meeting will be February 19th. Same time, same place here on Zoom. If there's no other questions or discussions, then I'd be happy to push this meeting to a close.
I do have one thing. One of my colleagues put in a separate chat to me around the rural health. Unique needs for rural health. And this is from Quinn Hill, who is our Bureau Chief for Communicable Disease, and HSM2 for Communicable Disease and Family Community School Health. She writes, the City of St. Louis Department of Health HIV and STD Prevention Program is supporting a subcontract to support high-impact community-based HIV testing in rural St. Louis areas, including Lincoln, Warren, St. Charles, Franklin, and Jefferson counties. I knew that. Okay, and then the focus is on addressing the unique needs of rural communities with priority populations. Thank you, Quinn.
Perfect. Thank you for the update. I was mentioning that thinking that it could be a leverage when we do try to advocate for funding, that you all are working in those areas that are impacted where there's not a lot of resources. I've had the opportunity to talk to some of the nurses at the health department in Franklin, and just hearing their story about how the minimal capacity they have as clinicians serving, an entire county. So we can talk about that, board members, at one of our next group committees, just to kind of get an alignment of how we advocate for federal funding. But I think knowing those 5 counties are included in your scope of work currently is important too. So thank you. Thank you, Quinn. Thank you, Commissioner Anwari. And then go ahead.
I should also mention our Ryan White program also serves those counties through their the state funding. Federal funding through the TSA, the population area.
Perfect.
catch.
Is is everybody familiar with the Ryan White program that understands like what its
Nope.
purpose is? Okay.
Yeah.
Now, Dr. Shacklin, would you like to say something about it? I'm putting you on the spot, but I
I
think you.
feel like the commissioner should be addressing this. There are
Okay.
different funds and you're in charge of lots of them.
Sure. So the Ryan White program was it's a program that's been around for decades. It developed out of a family situation where a boy named Ryan White got HIV through blood transfusion. It's now a program that it funds HIV treatment, testing, wraparound services for different catchment areas, and our catchment area, TGA, what does that stand for, EMBO? Targeted Geographic Area, I think.
Yeah, I think it's a transitional geographic area, and I don't know, I've never understood why transitional, but that's what I think.
It includes several of the counties that I've already mentioned. It also includes parts of East St. Louis, Illinois. And basically it's federal funding that comes directly from HRSA to support individuals experiencing HIV. And so again, it provides, it's a payment source of last resort though. So funding goes towards all sorts of things, including treatment, case management, transportation, housing, all kinds of things. And so we fund a number of providers in the region that conduct this work.
Thank you so much. Yeah, very important project when you're talking about access to care, which is one of the topics that came up in one of our internal meetings of if there's not a provider in the local area, that transportation will be given to them to one of the clinics that do have treatment, and they'll get to that place, whether it be an hour away or not, to be sure that people living with HIV had access to care. Thank you both so much. And then I do want to elevate that Shantae has put the CHIP chat in the chat, and also a wellness and relief flyer. If I can have any board member just grab those really quickly so that we can just have them for a record and upload those into our shared drive, that would be super helpful. Commissioner Nwari did also add the links for the 2 career positions that we could prioritize and support in getting filled. I also have captured those so that if anybody needs them, I can also share that with them as well. And then thank you, Deidre, for adding the articles from BJC. If there's no other thank you. If there's no other questions or announcements, now I'll officially close the meeting for today, and I'll see you all again in February 19th.